Cesarean section procedure, step by step. A cesarean section, or C-section, is a very common, well-established operation that many women have when delivering a child. In fact, the cesarean section surgery rate is about a third of all births in the United States of America. 1 This procedure is used for many reasons, including prolonged labor, high-risk pregnancy, large babies, multiples, fetal distress, breech presentation, a previous cesarean where vaginal birth after cesarean, VBAC, is not advised or desired, placenta previa, and cord prolapse. When the decision to have a cesarean can arise before labor, it is often called a planned or scheduled cesarean. 2 The decision might also happen in labor. This might be because it is thought that labor is taking too long, mother or baby is not tolerating labor well, or other issues arise like it is found that the baby is in a malposition. This is typically called an unplanned cesarean. In a few cases, it will be a true emergency, as in the case of a placental abruption, severe bleeding, or fetal distress. 2 Knowing what to expect may help you feel more comfortable with the procedure. Here is a picture essay, step by step of a C-section birth. 1 Cesarean section preparation and anesthesia. Prior to the surgery, you will receive your anesthesia, which is usually a regional pain block such as an epidural or spinal block. A regional anesthesia allows you to feel no pain during the surgery while also remaining awake to witness the birth of your child. In some cases of emergency, a general anesthesia is used, which means you will be asleep. While your anesthesia is being administered, the room will be busy as the other nurses and doctors are preparing the room with instruments and preparing the warmer for the baby. Anesthesia can take about 20 to 30 minutes to administer. The powerful numbing will happen quickly and effectively. 3 Sometimes, your arms will be strapped down in a T position away from your sides. This is done to prevent you from accidentally interfering with the surgery. You may also have a catheter placed. There will be a drape placed at your abdomen to keep you from seeing directly into the incision. However, you will be able to see the doctors, and most importantly, the baby when they are delivered. In most cases, the patient's partner or support person will be able to be in the operating room and will be positioned near their head to provide support and witness the birth. 2 Initial incision. In this photo, you see that the mother has been draped with sterile drapes and is in the operating room as they make the initial incision into their abdomen. In the vast majority of cases, the incision is horizontal, across the lower abdomen, below the belly button and just above or below the start of pubic hair. Also note that there is no need to shave beforehand. Hospital staff will do this if it is necessary, and it might not be. 3 Follow-up incisions. There are multiple layers that your surgeon must go through before reaching the baby. 4 This includes cutting through the skin, fat, into the abdomen, and uterus. The abdominal muscles won't be cut but will be separated in order to access the uterus. The bladder and intestines may need to be pushed aside. The doctor will use a variety of instruments during the procedure as they go through each layer of the body. 4 You may also hear whirring noises as a machine is used to cauterize or burn small blood vessels to prevent excess bleeding. Sometimes, there are strange smells, such as of disinfectants. While the C-section is a major surgery, any invasive procedure that enters a body cavity, such as the abdomen, the procedure is very safe and effective. That said, it does carry risks, like any surgery, such as of infection, blood clots, or hemorrhage. However, serious complications are rare.